Good morning, North Dakota. Thanks for joining us today. It's our first morning press briefing in over 40 press briefings, and many of you probably not on the still watching when we get to the very end when I thank Lindsay. So I want to thank Lindsay at the beginning for being here for through all of this. But again, thank you for joining us. Thanks for being one of the informed voices that helps guide North Dakota forward through these challenging times. We've got one guest print center today. Secretary of State Al Jaeger is going to be joining us midway through to share information about how and when voters can cast their ballots. And then also number of things going on within long-term care that we'll talk about today, and Human Services Director Chris Jones is with us today and will be available to answer questions afterwards about long-term care and the Vulnerable Population Protection Plan. And let me start with that. As you know, our COVID-19 response strategy in North Dakota has been to actively seek out and identify cases so that we can isolate those positive cases, slow the spread, and in the process save lives. And that involves, again, our vulnerable populations. And when we talk about saving livelihoods, this has been our dual mission to have an open economy but also have ability to save lives from this. We've built a testing regime that's tops in the entire nation. We have at the same time preserved hospital capacity. Right now, even though we're at near record levels for hospital capacity, that comprises only 2.9% of the total available beds and only 8.6% of the ICU beds. We've got kept our businesses open. We've got the nation's 6th lowest unemployment rate, 4.8% in August. And unlike a number of places, we've reopened schools and universities again, with local decision-making to have in-person or hybrid or however they choose, but we've got people back in schools. And again, as I talked about with the VP3, we've protected our most vulnerable populations. And this week in the state-specific weekly report that comes out from the White House, they mentioned in the report for North Dakota is among the best in the nation in finding asymptomatic cases through aggressive testing and thus preventing both nursing home outbreaks and limiting community spread. And that was direct from the White House. We have maintained one of the lowest case fatality rates in the nation at 1.07%. That's among the lowest of all the states. And the national level is 2.9, just under 3%. So we're about 1/3 the fatality rate of the nation. I want to just spend a moment on that because I know there's been a number of things circulating around on the internet, including that the fatality rate is 1/4%. But again, use good accurate sources, CDC website. Just under 3% of the people in the United States who've contracted COVID have died, and in North Dakota, it's about 1% of those people who have contracted it have died. We've done all of this, saving lives and livelihoods with a light touch of government, a strong emphasis on personal responsibility. And again, I think there's confusion about that as well, but we'll try to address some of that today. And again, with this approach, well, we still feel good about where we are in terms of low fatalities, open schools, and open businesses. We do have an increase in active cases in North Dakota. And then today we passed a very somber milestone, which is the 200 deaths of North Dakotans. Too many of our recent cases that we've had and of our deaths have been in our long-term care facilities. As you know, during the summer, we had a fantastic string of several months there where we had really contained when we started both opening up for visitation and also when we saw community spread in communities and our staff works and lives in those communities, it becomes more difficult to keep COVID out of a congregate living facility. And as we've seen around the nation and in North Dakota, when you do have COVID inside of a facility where you've got a vulnerable population, the results can be quite quick and quite devastating. So we're making a number of changes. One of those over the weekend is that our interim state health officer, Dr. Paul Mariani, and Department of Human Services Director Chris Jones worked on a plan to address this uptick that we're seeing in long-term care cases. We do now have 10 facilities out of 214 in the state that have more than a total of 10 cases of combination of residents, positive residents and positive staff. As a result, the Department of Health is taking action and adjusting our COVID-19 testing and contact tracing related to vulnerable populations, and I'll walk through some of those changes. Right now, when we do testing, as we have been almost weekly in long-term care residents and staff, when those come into the lab, as they've come in, it's always been in a little bit of a first come, first served. We process them through the state lab as the order they're received. We are going to be, because again, as we see in the statistics that the possibility of death from COVID is much higher among those that are vulnerable. When test batches come in now from long-term care, they're going to be moved to the head of the line, and every effort is going to be made to return results from long-term care tests within 24 hours. Our lab standard has been 48 hours, but we think, again, this represents the highest area of urgency. And because when you get a positive test of an individual in a long-term care facility, the long-term care facility needs to spring into action, as they have. The great work they've done on the front lines is to immediately isolate that individual, quarantine close contacts, or cohort the positives together, and then separate those healthcare workers that are supporting those that are positive versus those that are not, so that we don't have healthcare workers serving both positive and non-positive residents. Contact tracing, because again, we know that when we have a positive long-term care resident, they may have had visitors. They would have had contact with multiple healthcare workers, but again, doing really effective contact tracing of people that have been in close contact with those positive residents and with those positive healthcare workers has also been prioritized. So again, with the efforts that we're doing within contact tracing, we'll be prioritizing these vulnerable populations. The Department of Health is also, again, under Dr. Mariani, making some changes. We're moving to implement a plan which will allow us to use EMTs statewide and other first responders to help conduct the collection of test swabs. This will allow the department to reprioritize approximately 200 nurses that are available in its Department of Operations, which is a flex staff, which we've been using during this pandemic, but then we can get those 200 nurses to operate at the full height of their license to provide staff covering as needed, because when we have had close contacts identified among long-term care healthcare workers, they have to remain isolated. That hurts staffing levels, and again, we can provide some backup nursing, and those with different levels of certification, like EMTs, are qualified and authorized to be able to conduct the testing and the collection of tests. Also, as we talked about a few weeks ago, when it was announced in August, the White House very proactively has purchased 150 million of the new Binox Now point of care tests. These are the ones that don't require a machine or a lab. They're a $5 test with very high accuracy, and those are being shipped across the country, including to our state and including to long-term care facilities. And so we'll be putting together a team that is going to focus on how we utilize this new tool in our quiver, or new tool in our arsenal, or arrow in our quiver, in terms of testing, because again, these will provide us the ability to get a test result back in 15 minutes at high accuracy, and they could be used to assist when we have a resident that we might be concerned about, a healthcare worker that presented with symptoms, and as these tests become more available, they could help facilitate ensuring that visitors entering facilities are negative at the moment that they're entering. And so again, having that, and just from a scale standpoint, on the White House call, recall, on Monday, it was announced that collectively as a nation, we've done 104 million of the PCR. Those are the highest accuracy lab tests. 104 million of those have been conducted in the United States. The point of care tests, the Bionax Now test, the $5 test with a 15-minute result, the federal government, the White House specifically, bought 150 million of those. Those will be coming out between now and December, and so we are going to have to alter and change and adopt our testing strategies because the flexibility to have a low-cost, high-quality, fast result test is going to allow us to have some new options as we think about long-term care. The state is also looking at innovations in long-term care settings relating to screening, testing, disinfection. We're looking at, and we are working with some of the facilities in the state that have had these outbreaks to work with them in acquiring and installing very rapidly the air disinfection systems, because in some of our older facilities, we know that fresh air and getting the virus out of the air matters in these facilities. And so again, we're working with several of those right now, and we'll continue to look at making those investments in upgrading the disinfecting the air and the air exchange systems in our long-term care. We're doing all this because protecting the vulnerable is our top priority, and when we've made these adjustments, we're going to continue to double down on everything we're doing to protect long-term care residents and staff, while allowing for safe, responsible visitation that we know is really important to the residents' mental health and well-being. And it is important to note that the recent surge in cases in some of our long-term care facilities is really a reflection of the increased community spread. And so again, we want to make sure that we're doing everything we can to reduce those transmissible moments. And again, when we, as you were, we know that in our state where there's fierce independence and a fierce belief in our independence and our liberties, and that's appropriate. It's one of the things that makes North Dakota fantastic and great. But as I think we think about those, respecting our elders and respecting those that have given so much in their lives to help build our great state, as they reside in these long-term care facilities. And again, we've got the people on the front lines, these healthcare workers that are working with them to protect them. I guess we would ask everyone in the state, to find your why. Why would you, work to reduce the transmissible moments? Because if you can reduce transmissible moments, you can do that a number of different ways. You can do that by maintaining distance. You can do that by avoiding large gatherings. You can do it by wearing a mask. There's a lot of ways you can do that. Wearing a mask when you're unable to social distance. But if you've got a vulnerable family member, or if you've got someone who's in a long-term care facility, then you understand the anxiety of your kids, your grandkids, and the sons and daughters of these elders that are in there. But again, I think that everybody needs to find their why, whether it's a direct relative, a loved one, or if it's care about in general about the those that are in these situations. And if we can reduce the transmissible moments in the community, that protects the healthcare workers, that keeps us getting COVID into the facility, and that will keep us from reporting the deaths that we have. And again, I'm going to jump ahead to this on the thing before I go there. But since this ties to this, I do want to share, sadly, that in the last 7 days we've had 26 deaths in North Dakota. There is going to be some adjustment to there was a lag in the data. One of these goes back all the way to August 23rd, so some will even be adjusted out of the month of September and back into August. But of those 26 deaths that we've had, these are men and women in their 70s, 80s, and 90s with underlying health conditions. We have had, quite a bit of community spread in Burley Morton is one of the areas where we've seen that, and of those 26 deaths, 19 of those have been in Burley and Morton County, and a number of those in an individual facility. And so again, we are Our hearts go out to those families who've lost individuals, including those from today. There were 7 more reported today that are included in this 26, but which was a man in his 90s from Bottineau County, a woman in her 80s from Burley, a woman in her 90s from Burley, a man in his 90s from Morton, a woman in her 80s from Morton, a woman in her 80s from Stark, and a woman in her 80s from Williams County. But again, this provides an exclamation point on the need for us to, as communities come together to reduce the spread, to protect the healthcare workers who every day are on the front lines trying to protect those that are most vulnerable. Okay, well, let's jump into the county risk levels. As you know, in our state, we've got a 5 color-coded risk level that matches the color spectrum. I always refer to elementary school Roy G. Biv, but we've only got the first 5, so red, orange, yellow, and G for green, and B for blue. So Roy G. B. We have within these different color code levels, we've got guidelines that provide guidelines to at the county level, the city level, the business, the school district level. These guidelines were all built over the past 6 months with input from local public health, from industry groups, et cetera. So these were built collaboratively at the local level with input. As you know, that we went all the way up through just about school opening and Labor Day with the entire state at one color. Because of that great spring and summer we had, we were one of the states nationwide that had among the lowest positivity rate and among the least number of cases. And as we talked about, very few fatalities, less than the national average by about a third. So we were at low risk. As we headed back into opening up our schools with in-person learning, which is something we absolutely positively want to do, and we wanted to try to again make sure that we keep our businesses open and our schools open while protecting. This is this dual mission of protecting lives and livelihoods. On September 4th, we went to county level updates, and this is what the map looked like on that day. So we had some counties went to lower level risk to blue being better here. That's the lowest level. And yellow, where they went up, where we had higher levels of positivity rate and higher number of cases per population. So that's where we were. We said that we would wait a couple of weeks. A couple of weeks have gone by, and so today we're going to announce some changes on risk levels for counties. The first category we want to talk about is in the good news category. We have 3 additional counties that were green or low risk that are moving to blue, which has been dubbed the new normal. That would be Pembina, Pierce, and Rolette counties. Again, so congratulations to those counties for moving to the lowest risk level. The next level, we have some that were blue, which was the lowest level, that are moving to green. And in some cases, these again are in cases like Billings and Renville. These are cases that had relatively they have low population, and they have, and they likely before, when they were in blue, were in some of the states where we had even no positive cases. So you can, as they move up, if you have a small outbreak and you get a number of cases and a low positive, it can give you a high % positive rate. That's why we have the asterisk around Renville, because they jumped into the category of being one of the counties that had a higher than 10% positivity rate. But again, we're not overly concerned because some of these counties have less than 20 cases overall. They represent very few of the cases in the state, and because of the low population density in the counties, we're confident that those counties can manage this, but we are moving those 4 from blue to green. When we get into some of the higher population counties, joining some of our other population centers, moving from green to yellow, because we moved a number of our larger population nation counties went that direction back on September 4th, but joining a number of those counties in yellow include now Cass, Dunn, Emmons, McKinsey, Richland, Sargent, Stutzman, and Ward. And again, we've got an asterisk here at Emmons. Emmons holds the title now of having the highest positivity rate in the entire state. But as we talked about before, we've got a practice of not having any counties jumping 2 levels, and so at any particular announcement give citizens and businesses an opportunity to adjust in institutions as needed, but this is the counties that are going from green to yellow. And then we've got another group that we want to sort of put a caution flag up, and these are yellows that are still heading in the wrong direction. So on this dial, we've got the yellow moving up towards the orange, if you will, and that includes Barnes County, Benson County, Burley County, Morton County, Stark County, and Williams County. Again, those that have asterisks by them here are counties that have a higher than 10% positivity rate, which is absolutely a place we don't want to be, and they've got those higher rates on strong or adequate testing. Sometimes if you had very few tests, very few tests, you could end up, if there's only, 10 tests done in a county and 2 people were positive in the same family, you'd end up with a 20% positivity rate on those low numbers. We've distilled all of that out of this. All of these counties that we're mentioning here have substantial amounts of testing samples, and so we believe that the positivity rates are a reflection of the rate of infection in that county. There are a number of counties, a majority of them that have no change. We'll just put those up here, but we've got Grand Forks and McLean that remain at the moderate risk, a number of counties that remain at low risk, and we still have 9 counties that are at the new normal that aren't changing. They'll be joined by those at the bottom by the 3 that I talked about that are moving into those other areas. So then if we put the map up for the new risk levels by the state, this will be put up today. The updated guidelines will go into effect Friday morning. So this will what the new map looks like. I do want to give a shout out, because even within these categories of where people are moving back and forth, we've got some other really great performances, and one of those is in Grand Forks. And so this really falls into a call to action for those, particularly for those 6 counties with the higher positivity rates. And maybe we can pull that slide up again, the ones that have we're concerned about in terms of heading up. But these including right here in Burley Morton, we've got nearly 1,000 active cases in Burley Morton, and we know that again in these cities and communities around the state, we care about keeping our schools open. We know that everybody cares about protecting the most vulnerable. We know that, and so again, in some of these cases, like Burley Morton, there is a task force. In others, we've reached out to last night to leaders in communities and counties that do not have task forces. We have asked them to pull together whatever leaders they need, whether it's school, university, community, at the city level, at the county level, the local healthcare providers, but get local leadership in the room, because this COVID in the end is going to be the slowing down the transmission relates on one thing. We know that because we can see the results of the disease. What we can't control, and we can't really control it sometimes even with as I said all along, it's about what individuals do, not about what government says. But I think when we talk about local leadership, then the local leaders have to figure out in their community what's going to work, because what might work in Fargo or Grand Forks may not work in Williston or Bismarck Mandan. So people have to figure out within the context of their communities the local leaders have to come together and figure out what can be done. But everybody's got the same task, and I think that task should be uniform across the state, which is we're trying to save lives and we're trying to keep the businesses and economy open. And so finding that balance, and the way to do that, I think, is to focus maybe, again, as we've talked about before, we've had a call, as we have a call out for local leadership, we would maybe have a call out for, radical or more empathy. It'd be possible, I'm sure, in this stressful time, but if it's possible to have, less anger and more empathy, that would be a very cool thing for our state. And if we can focus less on all of the sort of the social media debates that have accompanied this pandemic, and really just focus on one thing. If we can all agree that the virus moves from human to human, that's how the virus moves. People can debate a lot of different things, but I don't think, I'm quite certain that is without debate. And if we know that it moves from human to human, then what we need to do is how do we figure out how to reduce transmissible moments. A great example of local leadership where we've put out the call for local leadership and we've put out the call for personal responsibility, and you can see it in the numbers where it works. We have a courageous new young mayor in Grand Forks, and he, after our task force meeting that we had with the White House in Fargo, went back and made, I think, a very difficult decision locally in his own community where he reduced bar closing hours from 1 or 2 a.m. back to 11 p.m. Small, simple step, but certainly symbolic to help reduce the in a town that is known for the social activities associated with the University of North Dakota. But anyway, they have gone from 7.4% positivity on September 8th. They're down to 3.6% now. So just in a matter of weeks, they've driven this thing down through community participation and support and awareness, and a few tweaks in how they were thinking about their local regulations. I've always said that the mitigation things that a local area can do to help reduce the spread is not a restriction on individuals' freedoms. It's actually the path to freedom, because Grand Forks, again, with those kinds of rates, lower rates, they are not only helping the whole state, they're not only helping all of the loved ones that live in long-term care in that part of the state, they're certainly helping all the surrounding counties who come to that community for shopping or health care. And so again, this is the kind of tailored local action that's tailored to local conditions, leadership everywhere. And that leadership can occur by elected officials, but it can also occur by the parents that are at home. It can occur by the leadership that people might provide on what they post or what they don't post. Leadership can be taking the steps that you need to reduce your transmissible moments so you can respect and reduce the possibility that you or others may be playing in a role in helping to spread this deadly virus. The color of the county change doesn't necessarily mean a school district should change their learning model. We do know that when we delegated the decision-making appropriately to the 174 independently elected school boards in North Dakota, when we delegated them, some of them did put together back-to-school plans that were tied to the color code, and that again was done with the best available thinking at the time this last summer when those plans were put together. But one of the things that we want to talk about in the with those school closings, it's important, is we're working with and encouraging our schools to think about how they can move towards having full-time learning in person. And why is that? It was initially thought that hybrid learning would help mitigate the spread of the virus, but it turns out that, again, if our goal is to reduce transmissible moments in a community, the students, when they're on their distance days, the days that they're not in school, if they're staying with their grandparents, if they're going to childcare, if they're being maybe grouping with neighbor kids that aren't in their classroom because of different age groups, whatever, because parents are figuring out and trying to navigate, how do I work on some days? How do I go to work on some days? How do I stay home when my kids are on their hybrid learning? We actually think that depending on how it's set up in each school district, you can actually increase the number of transmissible moments, and you're mixing kids back and forth between child care and grandparents and schools. And so again, the learning that we would have now, that if kids can get in school for a few days a week, then maybe they should be in school for 5 days a week and just stay cohorted. The schools are, in many cases, doing a great job of not mixing kids in the cafeteria and other places. So if we do have a positive with a teacher, staff, administrator, or student, it has less impact on the school. But it is we also know that distance learning, creates risks for kids in relation to their social emotional learning, and we also know that distance learning can cause significant stress on the economy of communities and family stability. And so again, we're making these color changes. We want to make sure that school districts hear and understand the new thinking about reducing transmissible moments, and they should thoughtfully and locally make a decision about what's the best way to do that, and if that can mean more in person but less mixing of students with other elements in the community, we certainly would support that. And again, as we move through these higher risk levels, these are guidelines, not mandates, but we are asking everyone to think through their why, their personal why this should matter to them, and how they can be a part of a solution. And one of the things that we really want to target our discussion today, and is, again, we've talked about being targeted, but let's talk about those of you that might have been identified as a positive or close contact. When we take a look at the number of positives which we have in the state today, which again I believe is a record number of active cases that we're at right now, and across the state, then there's a special group of people that need to really focus on not being included in transmissional moments. So if you're one of those individuals that today is positive, it's really important that if you're positive, that you are isolating till the time of your recovery. You, as being positive, are someone who again, if you practice all of the things that we talk about to slow the spread or reduce the spread, you can be a big part of that. There's been a lot of discussion about over this pandemic among epidemiologists about the R-naught, which is the rate of spread. If it's more than one, that means one individual who has it spreads it to more than one other individual. If it is less than one, then a person who has it spreads it to someone who spreads it to less than one person. It's clear that in North Dakota right now, our R-naught number is higher than one, because that's why our cases keep going up, or at least it's higher than one in certain counties. It was obviously less than that in Grand Forks County because their numbers are going down. So to do that, we want to make sure that we're being really clear about the importance of quarantine. We're asking that positive cases and their close contacts follow the isolation and quarantine guidance. And the close contact piece, again, we're going to be doing additional statistical analysis, but preliminarily we think that we may be coming up with a range that as many of 1/3 of the people who were identified as a close contact to a positive at some point themselves became positive. So if you think the possibility of getting COVID in North Dakota is very, very low, that is true certainly in some of our counties, less so in counties where we have a lot of community spread. But if you are someone who is identified as a close contact, meaning that you're less than 6 feet away for more than 15 minutes with someone who is positive, the possibility of you coming down with COVID actually increases significantly, and that's our own North Dakota data. So today, Dr. Mariani signed an amended state health officer order that expands quarantine to all close contacts. The way it was written previously was it had to, with the quarantine extended to household contacts. This extends it beyond household contacts to all close contacts. The health department has always recommended this, but this amended order brings in line with CDC guidelines. This means that close contacts of individuals infected with COVID-19 should stay home for 14 days past the last day they were in contact with a person who tested positive. Essential workers are excluded from this order. And again, when we go to how this disease and how it spreads, and the focus again today is that we know that it spreads from person to person, and the virus can't live unless it has a human host to do that. And we know that the primary way that the virus is getting into people is through the respiratory system, and we do know that again, if you do mitigation, whether it's wearing a mask, if you are in close proximity or maintaining more than 6 feet, or if you've moved here from Canada, more than 2 meters, if you have if we can practice those simple things. And again, so if people are not wanting to wear masks, it's very easy to not wear masks. Just make sure that you keep your distance from all other people. And if you're in a position where you can't, whether that's shopping or any other activity that you might do during the course of a day, then again, we strongly recommend that you do that to protect yourself, protect others, protect your loved ones, and help protect every business in our community, help keep kids in school, because that's what we can do. That's what we'll do by slowing this spread. Let's jump into the numbers for the week. And we've had 2,661 new cases in the last 7 days. Thankfully, 1,440 are newly recovered, and sadly, as I reported earlier, 26 deaths. We're now at 3,302 active cases. That would bring if we take the number of positive cases in the last week divided by the number of tests that we took in the last week, and again, that's the way the CDC calculates percent positivity. It's the way North Dakota calculates it. Information is all transparent and on our website, but that's 6.2% positive. And again, this is trending the wrong way. It's continues to edge out. Now, it's not climbing as steeply as it was a few weeks ago when we were heading back, into school, but it is still troubling that it continues to go up. And again, we know that it's going up because this is an average across the whole state. I've already highlighted that we have a number of counties that are more than 10% positive, and we have some counties like Grand Forks whose numbers are dropping as percent positivity to half of what they were. That's helping. The great performances in Grand Forks is helping hold down this number to 6.2%. And again, when we take a look at hospitalizations, which I mentioned earlier, again, we are currently at 89 hospitalized. We've shown a spike in recent days with a high of 92 yesterday. And again, sadly, of course, sometimes when hospitalizations drop, it's related to deaths that we've reported. And so again, not always something to cheer about when hospitalizations come down, but it is a important factor for us to consider and take a look at. But again, we want to reduce fatalities. We want to reduce the number of hospitalizations as well. So with that, that concludes at least this section of related to the changes on COVID. We are going to switch gears for a second, and we'll bring Secretary Jaeger to the podium. Election Day 6 weeks away. One of the things that we're grateful grateful for is our Secretary of State's leadership in this office going back 28 years. He's navigated a lot of challenges over that career, and now he's navigating holding elections during a pandemic, and he's reinforced North Dakota's reputation as one of the states that's not only secure place to vote, it's a safe place to vote, but it's also easy to vote here, and he's going to talk how everybody can have their voice heard. Welcome, Secretary of State Jaeger.
Thank you, Governor Burgum. The governor, to acknowledge the importance of voting, has signed a proclamation designating this week as a Voter Appreciation Week. And we appreciate that you're doing, that you did that. And mainly the essence of the proclamation is to, that we have a right to vote. It's important how, when, and where we're able to vote. And everything that the governor just has mentioned as a concern with the COVID is something that we as a people in the state of North Dakota administrating elections are taking very seriously. Today is 41 days from the election, and just kind of to start it out and just to share how some people really consider how important their vote is that by state law, last Friday was the first day that military and overseas voters were able to cast their ballots. And as of this morning, we already have 379 of them that cast their ballots located in 57 countries. And that's all possible because of our secure electronic ballot system. It's one of the best in the entire country, and our commitment as a state to military and overseas voters goes back at least 30 years. And so it's something that very important that regardless of where you live in this globe, that you have that opportunity to cast your ballot. Certainly on the state side level, COVID has impacted our lives and how we might do elections. And so as of today, we're launching a statewide voter outreach campaign to inform North Dakota voters of their voting options. This campaign is being made possible with federal funds that Congress specifically designated for election administration. Before I go into some of the aspects of what the voters are able to do, I really want to start out by commending and thanking the 53 county auditors, their election support teams, their county commissions, along with the governor and state legislature and my election staff for their commitment and dedication to making good elections in the past. And certainly we have had a good history of well-run elections in North Dakota, and we're doing everything possible to make sure that despite the COVID, that this is going to be another opportunity where people can exercise and take responsibility for casting their vote. So I really thank them for their dedication. It's also going to be the first election that we're going to be able to use our new voting system entirely. We weren't able to do that in June because we were in entirely vote-by-mail situation, but that isn't the situation for this election. So we'll be utilizing our new tabulators, and the one feature that will really be helpful is that we'll have electronic poll books in every county of the state, every polling location, and this really will add to the security of our election and the integrity of the election process. Tomorrow, of course, is the 40th day before the election, and at this point we are encouraging people, and part of our outreach campaign is to make a plan. And what do we do? What do we mean by make a plan? It's that because you have three different options in terms of how you can vote. You can have vote by mail, there's early voting, and voting on election day. So that information, those options are what we want to expand on and we want to tell people about. One of the things that I really want to encourage, because our website has so much information on it that I'll go into more detail in a few minutes, but I really encourage people to go to vote.nd.gov. And it can be very personalized back to your residential address. And I want to just stress again, it's vote dot, don't forget that first dot, that period, and nd.gov. And it'll take you right to a very robust website where really everything you want to know about elections is there. And we would sure encourage people to be able to take advantage of that. As of this morning, in terms of those three options, we already know that 168,000 people have elected absentee voting. So a lot of people have requested their ballots to be able to vote by mail. We have 10 counties that'll have early voting places. And so those will start out, some cases, 2 weeks prior to Election Day. And so people in those particular counties will be able to do that. And every county will have at least, every county will have a polling location open on Election Day. And the other option in terms of voting early is that every county will have at their courthouse what is known as in-person absentee voting. And for that, for any voter that may want to take advantage of that, we would encourage you to, check with your county to make sure that, the courthouse is open. If you need to make a call ahead of time or anything like that, set an appointment. Because we want every voter, if they want to vote, they make that decision to vote, we want them to be able to vote. Voting in North Dakota is a very easy process in terms of the requirements and mainly the identification that is needed. Regardless of which means of voting that a voter might select, again, we encourage them to go to vote.nd.gov. There's a lot of information, such as the voting options that I just explained. If they insert their residential address, they can find where they can vote, what their options are, their polling locations, the location of drop boxes. There's 86 of them that are stationed throughout the state, and so a voter tying into their residential address can find when they where that drop box is. They can view their sample ballot. And so those are all posted right now, too. One of the things that we really want to stress in this is that when people go on to the website, we really encourage them to encourage that the residential address is correct on the website. And if it isn't, there's a feature that they can go through and they can correct it. This ties in with the Department of Transportation. And it does, after you make the correction, it does take 48 hours to be able to update into the Center Voter File. The Center Voter File then is tied to the electronic poll books, and so when you come in to vote on Election Day and use particularly your identification, it'll really make a lot of difference in terms of the expediency of your election experience. One of the things with the address, one of the things that we particularly learned in June is that even though by state law, if you look at the back of your driver's license, you're supposed to notify the Department of Transportation within 30 days of moving that you have an address change. It doesn't mean that you have to get a new piece of plastic, but it does, with the internet, you can go to the DOT website and you are able to make that address change. And so this will be updated. That's reflected in the poll book and really will help in terms of the security of the election, the integrity of the election, and also getting you through everything. Part of the campaign will also be directed to the recruitment of poll workers. Poll workers are paid, and if an individual is interested in that, they should contact their county auditor. All the counties, they're really planning ahead. They have all of the plastic, they have face masks, they're going to have all kinds of protective devices for those people that actually either go to one of the early voting polling locations or voting on election day. Plus, we have purchased pins that will be given to each voter, single. So that'll be utilized throughout the entire state. And so, voters will have a pin that isn't going to be shared with anybody else. And so they'll be able to mark their ballot that way. One of the things with voting by mail, and one of the things we really want people to keep in mind, there's so much in the news about the mail. And so if you haven't already requested an absentee ballot, we encourage you to do that. Again, you can go to our website. There's a form that you can fill out and you can print and then send that in to the county auditor. We also know that some people don't have printers. And so in that situation, we'd ask that they contact their county office, and the application will be sent out to them. It's one of the things that I think is very important in the security of elections in North Dakota. Ballots aren't just automatically sent out. You have to request a ballot, and I think that's very important. You have to request it, and when you make that request, you sign your name, and then when you receive that ballot and you receive an envelope and a secrecy envelope to place that ballot in, and you return it to the county auditor, you sign your name again. And so there is a process where those signatures are compared, and it does help with the integrity of the election. And so even though any return ballot that's postmarked November 2nd or earlier can be counted. We really encourage that you don't wait till the last minute. Even in normal times, it takes a few days for mail to even inside a city, sometimes it takes a couple days. And so, again, allow time for receiving the ballot and for mailing that ballot back. And one of the neat things, again, with our vote.nd.gov website is that you'll be able to go in and you'll be able to track the ballot. It'll show when the ballot was mailed out to the voter, that date, and then when you return it, it'll show the date that the county received it. And so you'll be able to have the comfort of knowing that, what's happened to your ballot and where it is. With that, again, at the polling locations, the counties are taking a lot of precautions with that. Right now, based on the voter turnout, 4 years ago in the presidential election, it was just a little under 350,000 people. We're expecting now, with 168,000 people that have requested an absentee ballot, that in past elections we know that approximately 30 to 40% of the people have voted prior to Election Day. We're kind of anticipating that it could exceed more than half of the people that will have voted before Election Day. And when it comes to voting in person, either at an early voting location or with on Election Day, as the governor has mentioned, we would encourage, masks and all of the different things to safeguard not only each other, have social distancing, and also the poll workers themselves. Poll workers are I don't know if I should say that they're angels, but they really are. They start their day sometimes at 6 o'clock, 6:30 in the morning, and they go until polls close, and so they're putting in like a 12-hour day. So it's a long day for them. And so their commitment to the election process is really, really important. Again, there'll be a lot more details coming out. We encourage people, again, we really have a one-stop location with vote.nd.gov. There's a lot of information. And your county auditors, our office, if you have any specific questions, we're here to help. And we want to have we want you to have every opportunity, if you so choose to vote, that it's easy to do in North Dakota. We're here to help you, and we have a lot of support people. I just thought that just crossed my mind. One of the things in terms of that counties had made the decision, we have about half of the polling locations that we had 2 years ago. And so I only bring that up as you make your choice between voting by mail, voting at one of the centers, or on election day, that again, your decision as to where your comfort level might be in terms of which you choose, that's a decision that you make. And I think my staff keeps telling me that something to the effect that I think some of our promotion is going to be something about, okay, I had it written down here. Every kind. There's every kind of voter. And that is the vote by mail, the early, election day. There's every kind. And we want you to pick out which kind you are. So with that, Governor, thank you for the opportunity of sharing this information.
Thank you, Secretary, and thank you, Deputy Secretary Silrum, and all the county auditors for making sure that North Dakota's got one of the highest integrity, most secure, and easiest elections, in the easiest ways to elect people in the state or in the nation. We're going to, as part of the reason we moved this up this morning was because I've got to get to some meetings with legislators and local community folks in Fargo, and so I'm going to skip ahead to a couple things. One thing I would just highlight that since last week, it's gone through the Emergency Commission, the budget section, and then yesterday the NDIC, North Dakota Industrial Commission, has approved, but there's a new program out called CPR2, which is a bank-related program. Visit bnd.nd.gov. This is going to be a unique program where business owners can work with their local lender to apply for a buy-down of up to $50,000 in interest buy-down. Business owners will be asked to submit forms related to how much their revenue dropped between March 1st and September 30th this year compared to March 1st and September 30th of the year before. This unique approach will allow the businesses with the largest percentage decrease in revenue to be put at the front of the line, if you will, for these interest buy-down grants. In addition to that, other COVID recovery programs, the Small Employer Loan Fund, the Ethanol Recovery Program, the Agriculture Disaster Relief Program, some of those still have windows open, as does the CPR1. So again, number of economic assistance programs, including a brand new one called CPR2, just now available at bnd.nd.gov. Again, we have always talked each week about the importance of behavioral health during this time period. And again, just want to quickly say that we've got coming up on October 28th, Wednesday, October 28th, the statewide Virtual Recovery Reinvented event will be occurring. And then also to steer people to a Families Strong. It's a free online support group designed to help families impacted by addiction develop self-care, build social supports, and learn strategies for interacting with a loved one who's struggling with a disease disease of addiction. And it's a 9-week curriculum course, but could really help a family if they have someone in their family who's really struggling with addiction. And it's a completely free. Spots are limited. I encourage you to reserve a space, and you can learn more about this program again at visiting recoveryreinvented.com, the Get Involved tab. And then skipping to one other announcement, it's related to tomorrow. I've got the honor to present the 2020 Governor's Awards for Excellence in Public Service. This year we had the pleasure of reviewing more than 800 nominations of the incredible Team ND members from across agencies and all branches of government. Tomorrow we'll celebrate virtually this year's recipients. We want to share our gratitude today with all those 800 who were nominated and the nominators who made this possible. And again, within this ongoing response, our nominees have delivered incredible work products and service for our citizens, and we hope you can join us tomorrow. This has always been an internal ceremony, but tomorrow the whole state can watch it, and a link to view will be available on the governor's website, governor.nd.gov. Tune in and learn more about the great work being done by Team ND members. And in closing, gratitude quote, appreciation can make a day. It can even change a life, and your willingness to put it into words is all that necessary. And I want to thank all the nominators who wrote those 800 nominations. They did put their appreciation into words, and that is a peer-to-peer selection process where, again, the nominations made by other folks that are working with them. We'll be back here next Thursday, October 1st at 3:30, so 8 days from now is when we'll be back. And with that, we got time for just 1 or 2 questions is all. We'll go with Jack first and then Jacob.
In the early days of this pandemic in North Dakota, people put up window displays of hearts and promoted hashtag In This Together. But at last night's Bismarck City Commission meeting, there were allegations of personal attacks amid the public health response to this crisis. There have even been comparisons to Nazi Germany. Why has the mood shifted since spring?
Well, Jack, you I think, ask a very deep question about the social psychology of how humans, react to prolonged periods of stress. And I would say also that we're in a time period where there's always been, since you go back even to, the ancient civilizations of Rome and Greece, there was wherever free speech has existed, there have been people that exercise that right in a way to protest decisions made by government, and that's part of the healthy elements of democracy. So this is not necessarily a new thing, but there's a certain amplification, I think, that comes with social media, and social media is designed really in some of the platforms are really designed not for nuance, not for understanding, not for empathy. They're designed to amplify conflict. And I think that can really sort of change the demeanor of a conversation. But I would say that, again, I just call out to all North Dakotans, regardless of any political party affiliation or any beliefs or which social platforms or which groups you're on. At some level, we have to try to regain a connection with our own humanity. We have to understand that we are in this together. We do have to understand that this invisible virus moves from people to people in a very unfair and unjust way, in the sense that it can move from one person who might have no symptoms, and the next person it's deadly to them, and so again, it is a so I just, again, that's where I call for the people to deepen their curiosity, to really understand other people's point of view, as opposed to just seeking out information that reinforces their own perhaps viewpoint or bias. I think it's important for us to, again, try to put ourselves in the position of a parent who's got a child with an immune deficiency, or put yourself in the shoes of someone who's living in a congregate care facility, and we're saying that it's 1% of the population in North Dakota, this is fatal. 3% in the United States. But if you take a look at people within a long-term care facility that come down with COVID, the possibility of death is much, much higher than that. And so it's why we're fighting so hard to keep it out. I mean, I think if you had a loved one, that had if you thought that if some action you took might create a 1 in 10 or a 2 in 10 chance that someone might die, you probably would think really carefully about it. So I think, again, I just would hope that as we continue to move through this, because this is not a forever thing. It's not a forever. It's until we get to the point where we've got more readily available low-cost testing, where we can get fast responses. That will really help us, protect people in long-term care. It'll help us, keep moving back towards large gatherings more quickly. And so this is just the advances in testing alone will allow us to get back closer to that normal that people really seek. But I'd say another thing, to expand on this too, is sometimes I'm reminded of these debates right now about that sort of frame around infringement on personal rights. We heard a lot of these during a debate for 3 decades around smoking. Hey, if I can't, smoke in a restaurant, it should be my personal right to smoke where I want to smoke. And I think over time there became an understanding that might have been your right, but you're also infringing on someone else's right at the next table, because secondhand smoke turned out to be, a way to get lung cancer. And I think, in the end, societal norms changed, culture changed, rules changed, and some of those may in fact have infringed on a person's right, but they protected other people's rights. And so again, it's always a balance when we're talking about the liberty and freedom. And again, I guess where I would say is that if we want to fight for and have respect for liberty and freedom, to choose a certain path during this pandemic, then we have to have the respect and empathy and understanding to respect others that might choose a different path because their situation may include vulnerable people in their immediate families, and they want to take more mitigation steps. They want to make sure that their loved ones remain alive and healthy. So I think, again, it's a challenge because of the duration of this thing, but I believe in the better nature of North Dakotans, and I believe that deep down there isn't anybody in the state that wants to cause anybody else harm. I believe that. And so then that's why I think, again, locally, getting local leadership involved in these communities where we've got wider spread and where it's moving into nursing homes, those local leaders tapping into that commonality. I just saw another national news story about farmer who became ill and all the neighbors rallied to help him harvest. That's the North Dakota I knew and grew up in, is people looking out for each other in that way. And we've seen it during floods, we've seen it during blizzards, we've seen it during hard harvests, and I would hope that we can revive some of that spirit of thinking about others and thinking about our neighbors, which has been the hallmark of our state since the beginning. If we can pull some of that together here in these months, I think that maybe the most difficult months of the pandemic is right now, where there's fatigue, and yet we aren't at a point where we're going to have some great new mitigation tools like the testing that I referred to. So anyway, this is a time when leaders have to step up at all levels. Local leaders have to step up. It's a call for action to try to tap into this thing. You've really, in your question, really get the heart of the challenge we're facing. Jacob?
Governor, in reference to the county risk levels, last week you pointed to Williams and Starr County as counties to keep your eye on. They're in moderate. In that week, their active case count and their daily positive rolling average have both gotten worse. If the change in classification doesn't change legal enforcement of guidelines, what is the concern in changing their risk levels?
Well, I think that there's not I wouldn't call it a concern. Again, we're trying to navigate to where we can get the highest amount of engagement and incentive. We want to incentivize local communities to take the actions that allow their businesses to stay open, as opposed to to sort of go the other way, which would imply that we're trying to stay away from, if we can, getting back to where we were, where we went to last spring when we knew a lot less, which involved business closures. So, when again, with this dual goal we have of lives and livelihoods, so I guess we're kind of putting folks on notice that this is a time for them to step up. But if we moved somebody a week ago, a week isn't really enough to drive the change. I mean, the increased rates we may have seen this week are from what happened prior to us changing the color, because again, you've got a multi-week lag, and I think we're seeing some of it in the numbers in these counties going up as a reflection of a combination of Labor Day gatherings plus getting everybody back in school. We knew we were going to take added risk on and create more transmissible moments as we went into the fall, but with that, we've seen, as we've seen in Grand Forks County, that you can do slight changes in mitigation and have big impacts in your numbers. And so we've got proof cases here that local leadership can really make a difference, and we would again ask all those counties that are moving up the risk level, actions that you take earlier versus later produce quicker results. Jeremy?
Governor, in the past you've mentioned that deaths are a latent indicator in terms of directing policy. Should the state have taken more steps with long-term care before all of these deaths came this month and late last month?
Well, I think if you take a look at the sort of, again, the somber statistics of both infections and deaths in long-term care, we had some early outbreaks in Cass County early on. We took very aggressive steps to really lock down. We locked down visitation. We put in the most aggressive and robust testing regime in the country. 3 or 4 months before the White House or the CDC came out with recommendations of doing weekly testing, we had been doing that in North Dakota. We were only able to do that because we had built up the testing capacity. I mean, there was very few states that had the ability to, test people who were symptomatic, do surveillance testing, test everybody in our correction system and test everybody in long-term care, healthcare workers in a week. So we had some tools, and if you look at over the summer months, low infection rates, almost no facilities that had more than 10 active cases. And then as we get back into this fall, where we have community spread occurs, the belief is that we're still, I think, doing a good job of managing visitation. The way it's getting into the nursing homes is through healthcare workers. Those healthcare workers are a reflection of the communities they live in, and so that's again why it comes back to the communities. It's not just up to the nursing home administrator and their staff and the relatives to protect the vulnerable. It's the whole community's job to protect the most vulnerable, because until we have such time that we can test every healthcare worker every day that walks into the facility, until we get to that point, then we have to, again, low community spread. In places where we've got low community spread, we've got low infection rates in long-term care. So I think we were extremely proactive relative to the rest of the country, and I don't think there's an appetite among family members to go backwards on visitation, because the visitation, we know, is also an element of their well-being and mental health. So again, it has to do with community spread and healthcare workers. And like I said, we've made the changes that we announced today to be even more aggressive on turnaround on testing times, the ventilation systems, the clean teams that are going in these facilities where we've got high rates of infection, but really pouring our energy into it. So keeping at it is a top priority. Lane, and then I think we got Mike. They got to head out after that. Okay.
Just looking for some clarity on the quarantine order. For close contacts, is that a requirement to quarantine, or is it just a recommendation? And if it is a requirement, is there any penalty for breaking the quarantine?
The state health officer has authority and legal power, and they are enforceable, and so it has been in place today that if you're positive, you must quarantine, and then it was recommended for for household contacts were included in that. We made a differentiation early on and said close contacts were not. We're adding close contacts along with household contacts under the thing that has the force of law, but that enforceability will be up to local jurisdictions. We do know that our local public health organizations have been asking for this because of this differentiation. They do think that in places where we have community spread that this could give them a little more clout, if you will, in terms of the enforceability, but in terms of how it actually is enforced is going to be up to the local communities, and local communities are going to have different different levels of capacity to do this enforceability. But again, I would appeal to what people do as opposed to sort of what government does, because if you are a positive and you can get other people sick that might die from this, I would hope that would be enough for someone to say, hey, I should probably make sure I avoid transmissible moments with other people. If you're a close contact or household contact with a person who's positive, and we now know that there's probably a 1 in 3 chance that you may turn up positive yourself, you would probably also say, hey, I don't know if I can get somebody else sick, but if it's a 1 in 3 chance that I could get somebody sick, and the person I get sick who might get somebody else sick who works in a healthcare facility, and then that person carries it in, and a dozen people die in a nursing home, and if we could actually lay out the chain and see, where your actions, where it went to, and that it did in the end of the day maybe result in death, that might be enough. But I think that we're challenged for people to understand maybe every day, not just during a pandemic, but for people to understand every day how their actions, no matter how simple they are, could have profound effects on others they may not even know. And that's the communications challenge we're dealing with here. So again, but we are matching up with the CDC guidance so that our health officer and our local health officers, when they issue these orders, it matches up with the CDC guidance. Okay.
We do still have Chris Jones on the line and Secretary Jaeger here to answer questions if anyone has questions.
Okay, so I'll take my leave to get going, but Chris Jones apparently on the line if you got questions on VP3, and Secretary Jaeger here for things related to voting. Thanks everybody for being here. We'll see you next Thursday.
Let Lindsay get back on. There was some discussion about making sure the election is secure and whatnot in November. For the primary, there were 40,000 ballots that went unreturned on election day. Wondering if that's going to be a concern in November.
Well, quite frankly, that kind of puzzled me, that people did request a ballot, didn't return it. I'm told by some of my election people who have had long time experience in this that that's not an unusual happening, that not every ballot does get returned. And so that was a little surprising. I would suspect that November's election is going to be a little bit different. The fact it's a presidential election. And so I would suspect that if you've requested a ballot, our percentage probably is going to be higher. And also, just because they've requested a ballot, they might actually choose to go and vote in person. And that's why our electronic poll book is so important, because once you voted, the system is going to know that you voted. And so, why would you request a ballot and not return it? Well, there's a lot of reasons that might happen. So, and yes, Dave.
Just to follow up a little bit on the appeal for people to be poll workers. Are counties telling you that they're concerned they may not have enough staff?
Well, it is a concern, and we want to make sure that there is a process in law in terms of who can be on the election board. it has to be politically balanced and all of that, so that does become a factor. But yes, what we want to make sure is that the counties do have them, and if anybody is interested, to make sure. One of the things that I mentioned, while it's a long day, there's people who have exercised their civic duty, if you might call it that, for many, many, many years. And so what's happened is our poll workers are they talk about this category about, age and being more, it might be more possible that you could get COVID and all of that. Well, some of those people are saying, we're not going to do it this election. So we want to make sure that the counties are covered. And so, again, if anybody has any interest, we would encourage them to do it. It's yes, you get paid, and maybe in some places there'll be an extra donut or something, but over the years it has been kind of a social event too, which some of you that have been around for a long time, I mean, you know that you've been to the polls, you've reported on polls and stuff like that. So, but anyway, we want to make sure it's covered. And did somebody else say they had a question someplace? I saw a thumbs up over here. That must mean no. And
Chris Jones is still online. Thank you, Secretary.
okay, all right. When Mike says thumbs up, that's the one I listen to.
Chris, can you hear me?
Yes.
Hey, Chris, a few months ago when long-term care facilities were starting to restart their reopening operations, there were the phase 1, 2, and 3 policy in place. Is that still in place, and have some long-term care facilities needed to go back a few phases as of late?
Yes, that is still going on right now. We haven't formally moved any back, but as there's been outbreaks, the long-term care facilities themselves have made moves to restrict visitation. We continue to learn new things as the virus spreads. Some facilities actually are seeing more transmissible moments due to congregate dining, and some are seeing it more to healthcare workers. So we're continuing to work with them to figure out what is the best way to continue to move this forward. And I think, there's still this ongoing threading of the needle as it relates to how do we appropriately manage the risk of protecting the residents in long-term care facilities versus the visitation and giving individuals time to spend with their loved ones. And it's not an easy task, and it's not something that one is more important than the other. We're starting to actively look at what are we going to do when it gets cold out, because outdoor visitation will not be a viable option. So we need to continue to work through that. Secondarily to that, there are new guidelines from CMS on visitation that we're looking at. For the most part, we have slightly more open visitation policies, but we want to look at that and make sure that it's right for North Dakota moving this forward.
Do you guys have any other questions? Because I got another one.
You go ahead.
Okay. Considering the recent outbreak numbers and the new close contact quarantine order, is staffing going to be a concern in the near future?
Yes, staffing is already a concern. We have part of the testing strategy has been for any healthcare worker that tests positive and close contacts, they have been furloughed. So we are, working with the Department of Health and other agencies to make sure that we have the appropriate number of healthcare workers, because the last thing that we want to have happen is to have to use positive asymptomatic healthcare workers in skilled nursing facilities. So yes, the healthcare workforce is already under stress. going forward.
Numbers that go along with that, Chris?
What's that?
Are there any numbers that go along with that? Do we know how many have been furloughed or a percentage of how many were down and who knows how long?
We can get that to you. I don't have it at my fingertips. It's not something that we actively look at because we're working more one-on-one with individual facilities as they need staffing and working with them. It's not something that you really manage on a whole like statewide basis, other than the fact that we know that it's becoming more difficult to find as needed workers in these long-term care facilities.
Thank you, Chris.
Chris, this is Jeremy Turley from Forum News Service. We reported yesterday that 8 COVID deaths that were reported on the same day, that was last Saturday, occurred in a single facility. That was something that you told Robin Hubner. One of those facilities that had a major outbreak was in Glen Ullin. I'm just wondering, in a situation like that where there's such a severe outbreak, where does the breakdown happen? Is that with staff bringing COVID into the facilities, and if so, how do you manage that lack of staffing?
Yeah, so maybe even to step back, you know, if you go back a month or two, I mean, even the outbreaks that we had in Cass County were not to nearly the level that they are that we have in a few facilities today, and it's a new time. I think, and there's multiple functions, reasons for that. I think there was a question earlier on, I believe it was from Jack Dura, you know, kind of the fatigue of everyone. There's a fair amount of fatigue in long-term care, and as the governor said, it's whatever is happening in long-term care is a representation of what's happening in the community itself. So, you know, I believe in Glen Ullin they had approximately 52 residents at the time of the outbreak, and at this point only 5 or 6 have remained negative. So it has pretty much spread through the entire facility quite rapidly. And it's not necessarily, if I understand your question right, I would say it's multiple breakdowns really. But I don't want to make it sound like it's a blame, but we've got to recognize that it's a function of fatigue, it's a function of community spread, just being so adherent to our PPE within the long-term care facilities, and then recognizing that we're running out of staffing. So, you know, when I say fatigue in long-term care, it's the fatigue of the virus, but it's also the fatigue of the work. So that is what is going on.
Thank you.
You good? All right, sweet. Thank you, Chris.
Thank you.
Okay, hearing no other questions, I think that's all we have for the press briefing today. And I just want to thank everyone for tuning in. Again, as the governor said, the next briefing will be next Thursday at 3:30 p.m. Thanks.